I'm sure many of our viewers out there are wondering what exactly diabetes is. Diabetes is our body's ability to change the food we eat into glucose. This is done with the assistance of insulin, which helps glucose move into our cells, where it can then be used to make energy. Now, if you have type 1 diabetes, which is common in children and young adults, your body makes little to no insulin. Whereas a person with type 2 diabetes, also known as adult onset diabetes, is common in people who are overweight, inactive, or have a family history of diabetes. And their bodies have the ability to produce insulin, but may not use it in the right way. There is also a condition known as prediabetes, which is a condition where your glucose levels are higher than normal, but not high enough to be called diabetes, which is a serious problem because then you're at risk, a higher risk, for type 2 diabetes. All of these things can lead to too much glucose in the blood, which has the potential to cause dangerous health issues if not managed properly.
Well, hello, Michael, and now I'm taking our audience to a segment I like to call Kidneys on a Bladder Full. This week we visited 2 destinations diabetics will certainly want to avoid. Many of you out there may not know what your kidneys do for you. The kidneys filter your blood, dispose of the body's waste, and reabsorb protein. Your kidneys have millions of blood vessels, which are your blood's superhighways of filtering. Now, many of you may be asking, how does this relate to my diabetes? The answer is, high blood glucose levels and high blood pressure can damage your kidney's blood vessels and lead to a destination called nephropathy. Once you arrive at nephropathy, the town locals like to call it kidney disease. Kidney disease interferes with your body trying to filter wastes and spills proteins into the blood. Kidney disease is one destination you will want to detour from. Another destination we visited this week was ketoacidosis. This is another road trip to Hades diabetics need to avoid. Ketoacidosis happens when your body uses fat instead of glucose during insulin deficiency. When the fat does not get used up, ketones are left. They are very harmful to your body and can lead to acidosis. With regular urine and blood tests, blood pressure control, medication, and lifestyle modifications, you and your healthcare provider can map routes away from kidney disease and ketoacidosis, 2 places you never want to visit. And on that note, that concludes our segment, Kidneys on a Bladder Full. Thanks for traveling with us.
One of the manifestations of diabetes is diabetic retinopathy. This is where the small vessels that carry blood to the thin light-sensitive lining of the back of the eye are damaged. There are often no symptoms in the early stages of the disease, but after 10 to 15 years of diabetes, almost all people with the disease have some changes in the retina. Changes include cataracts, which are clouding of the eye lens, or glaucoma, which is an increase in fluid pressure inside the eye that leads to optic nerve damage and loss of vision. The longer diabetes goes on unsuspected, the more likely diabetic retinopathy is to happen. The way to prevent optic damage is by having regular eye exams to detect changes to the eye. If diabetic neuropathy is detected, your eye care specialist may suggest laser surgery, in which a strong light beam is aimed at the retina to shrink the abnormal blood vessels. Talk with your eye care specialist if any changes in the retina are noticed during your regular eye exams.
One of the side effects of diabetes is neuropathy. When your blood glucose is too high for too long, it damages your nerves, and eventually your nerves can't send their signals throughout your body the way they should. This kind of damage doesn't happen overnight. It happens slowly, and you may not notice that you're losing feeling in your hands and feet. Be sure to ask your doctor to test you for loss of feeling in your feet, because you may not notice cuts and infections if you can't feel them. This could lead to serious problems, including amputation. There are other symptoms of nerve damage that cause neuropathy. You may sweat a lot, feel dizzy, have digestive issues. You may feel full or bloated soon after you start eating. You could have diarrhea that won't stop, or sexual or urination problems too. The longer you have diabetes, the more likely you are to develop neuropathy. However, having good blood glucose control may reduce your chances of neuropathy by up to 60%. Some things you can do to prevent or delay neuropathy are lower your blood glucose if it's high, lower your blood pressure if it's high. If you smoke, stop. Exercise daily to increase blood flow to your hands and feet. Take good control of your blood glucose levels and check your feet daily for redness, blisters, cuts, or changes that you notice. And finally, be sure to see your doctor every 3 to 4 months to check your diabetes and test your feet for feeling.
Alright, this is your cardiac advisory report. I'm here to guide you on a heart-healthy path. Diabetes makes you 2 to 4 times more likely to have a cardiovascular disease. Diabetes also can cause damage to your blood vessels, making them easy to be clogged by cholesterol. To lessen and avoid a cardiovascular issue, you will need to monitor and reduce your overall cholesterol, including your triglycerides and your lousy LDL. while increasing your heart-healthy HDL. This goes along with other nutritional precautions such as avoiding salt. You're also going to want to increase your physical activity. This will help fight obesity, reduce risk for an MI, and is great for a healthy heart. Some of the things to avoid are going to be poorly controlled blood sugars and smoking, which just makes your heart work that much harder. This is it for this cardiovascular advisory report.
Overall, the blood glucose level is stable at this moment in time, but the average A1C will tell us how well controlled the level is being maintained. We've got a bit of an overcast situation going on in the northeast. This nicotine storm will cause a decrease in visibility, and with ongoing time, if it is not relieved, will become permanent with a zero visibility if it does not change its direction. The smoke will also cause an impact on the cave and deeper in the caverns to the south. And the storm can also cause damaged blood vessels and impede the electrical impulses in the erosion and ulcerations in the south regions, and can result in losing parts of those regions. The nicotine storm will raise the blood glucose level and the A1C above the preferred levels. We also have a sympathetic nervous system coming out of the southwest that, if not relieved from the constant stress levels, will also raise these levels. This naturally occurs from the instinctive flight or flight syndrome, which is also our shark in the water syndrome, but can also occur from things such as parenting and nursing school, which can also raise these blood glucose levels quickly and substantially. The forecast is, unless we eliminate this nicotine system and the sympathetic nervous system eases up a bit, the A1C is going to be well over the recommended average. The kidney regions and the heart region are going to be damaged and fail to function properly, and the gastric region may become unstable to volcanic disruption.
When it comes to your teeth, there are a few things you need to know. The first thing is to tell your dentist that you have diabetes. You may now be more prone to dental problems such as thrush, gingivitis, damaged blood vessels, and plaque due to increased sugar in your mouth and your body's decreased ability to fight infection. It's very important to report any signs of bleeding, pain, loose teeth, sores, or anything else out of the ordinary to your dentist immediately. Continue to brush your teeth thoroughly twice a day, as well as flossing once a day, and have routine dental exams every 6 months. Avoid smoking and keep your blood glucose levels under control.
And now on to foot and skin care. There are some important rules to ensure that you have adequate foot care and help prevent complications. First, check your feet daily. If you can't see them, use a long-handled mirror or ask a friend for help. Number 2, wash your feet daily as well. Use soap and water, but make sure it's warm water and not hot. Never use hot water. Number 3, if your feet are cold, wear thick, soft, non-constricting socks, but no heating pads. Number 4, after bathing, make sure you dry them thoroughly. Don't let those piggies stay wet. Make sure you dry in between them. Number 5, and if your feet are dry, use doctor-approved lotion, but not between the toes this time. You don't want fungus in those piggies either. Number 6, get diabetic shoes. They are wide and deep, but remember, no bare feet. Number 7, check your shoes before putting them on. Rocks and sharp edges can cause injuries. And number 8, trim the toenails and trim them straight by using an emery board, because you don't want any sharp edges. Number 9, have your doctor check your feet in circulation at every appointment. It's very important. And for skin, keep it basic. Lotion the skin while it's still damp after bathing, and use soft towels to dry your skin, and check for wounds while you're doing so. The second most common reason for diabetes patients being hospitalized are due to foot and skin wounds. You will have delayed healing due to any injuries you may heal. So make sure that you take proper care of your feet and skin. Thank you.
Alright, hello, this is Michael, and I'm reporting on your blood sugar storm today. Today's high is hyperglycemia, a condition in which blood glucose is above 240 milligrams per deciliter. Some complications from today's high are diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome. So remember to count your carbs and take your insulin. Tomorrow's low is hypoglycemia, a nasty condition of low blood sugar below 70 milligrams per deciliter. So for tomorrow, remember to check your blood sugar levels and have a carbohydrate snap to stop this from happening. Thanks for watching, and have a great day.